Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert, and I am on via Zoom with the great and famous Dr. Millicent Ravello. How are you?
I am good. How are you?
I'm doing great. I'm excited that we're able to get a few podcasts in, and I am pretty excited about this next one because it's been coming up recently in my practice, since there are all these new fillers that are trying to take the place of facial implants. And
yes.
I mean,
tell
have
me a
you
little
seen
bit more
these?
about that. Well, why don't you tell me a little bit about what you're thinking? Because I think I know what you're talking about, but I want to make sure we're on the same page.
What I'm talking about is that there are now indications for Voluma, which is a filler made by Allergan. It's a hyaluronic acid, where they've actually gotten indications for chin augmentation. And I guess, using it off label for jaw augmentation and cheek implant augmentation kind of is not too far fetched. So they're really trying to obviate the need for facial implants. And I do a lot of facial implants in my practice.
So this is sort of an ongoing theme of fillers versus surgery, because the non-invasive world is constantly trying to come up with ways to imitate or mimic a surgical solution, and sometimes with success, sometimes with not so much success. And historically, Voluma, which is one of the heavier hyaluronic acid fillers, has been used in places that require a deeper, heavier filler. So any place where you can put filler along the bone directly is a great place for Voluma. So we've been classically using it in the cheeks for many years now to augment the cheeks. And that can be for cosmetic purposes if you want more defined cheekbones. It can also be to help with the aging effect as the face sort of falls off the cheekbones. One way to imitate or mimic a facelift is to put fillers along the cheekbones to sort of lift things back up. That being said, you need a lot of filler to do that successfully in the aging patient. But now the other indications, as you referenced, are for the chin and for the jaw. So we've been doing that for a little while anyways with Voluma, to varying degrees of success. But I think jawline fillers are really having a moment right now because I do get a lot of requests for those. So the idea is that for the chins, you're either making the chin come forward a little bit more in space if you have a weak receding chin. You can also make it a little bit longer. That's a little bit harder to do. And then for the jawline, you're really defining the jaw. And we can see that more commonly actually not more commonly, but we see it more often in men than we do any other fillers. But women also are asking for the jawline definition as well.
They definitely are. They are definitely wanting definition.
Yeah.
In fact, I had a patient. I did a revision rhinoplasty with a rib graft, and then did her facelift. And then after, she said, "Don't you think it'd look great if I had some jaw implants?" And I said, "I don't know. Let's put some filler." So put some filler in, checked it out, said, "You know what? Looks pretty great." Went back, put in jaw implants because she didn't want to have filler all the time, but she also felt that the filler was not the crisp, clean look that she was looking for. So artistically, she was not really thrilled with the filler because I agreed with her. I think the filler is great and it's a good way to kind of test things or to see things. But I think if you like it enough, it's pretty straightforward to get these facial implants placed.
Yeah, I'm always very suspicious when I see these befores and afters on Instagram with the jawline fillers. I am super suspicious because I don't know. A lot of them just look very altered to me because especially if you have an older patient that has some loose skin, you're not going to get this crisp, clean jawline with just fillers if there's saggy skin hanging over it. So I think look at the befores and afters with a little bit of grain of salt in terms of what they're actually accomplishing with fillers. The best person to have jawline enhancement with fillers alone is someone that's probably younger with good skin tone and a face that's not too heavy. So you can actually see the definition come through. But really, if you're looking for that definition and you have a heavy face, whether you're young